Today I have Dr. Jason Mills here with me to help us wrap up. We are MUSC Pharmacy Advocates Week of Celebration. Jason is the Pharmacy Supply Chain Manager here at MUSC Health and currently serves as President of the South Carolina Society of Health System Pharmacists. He also teaches and coordinates our management course. Jason, thank you for joining us. I know you've taken away from the South Carolina Society of Health System Pharmacists virtual fall meeting to talk with us, and we really appreciate it.
My pleasure.
Can you just tell us a little bit about what you do for MUSC Health, and how did you end up here in Charleston?
Yeah, sure. Well, hello, Philip. And I'll first start by also saying happy Pharmacist Month, and thank you for the opportunity to speak today. How I got here, I don't think is too complicated. I graduated from the Ohio State College of Pharmacy in 2006. I wrestled with whether or not I was going to do a residency. I really knew I was going to get into hospital pharmacy. I'd been around leadership in a hospital pharmacy, really gravitated towards that. I really liked, working with people, leading people, managing projects, things like that. But I will admit I had some maturing to do because the prospect of engaging in a 2-year residency with the promise of a master's degree on the end of it just sounded like too much school for me at the time. But all that being said, despite me not having done the residency, when I still meet with students and they ask me my opinion on it, I highly advocate for it. So I'll just put that little plug in there, especially if you're going to go into hospital practice. But MUSC had been on my radar for a while. I jumped at the opportunity to work as an inpatient pharmacist. From there, I became a coordinator within that pharmacy for about 3 years. And it was during those 3 years that my mentor at the time really did take me aside and said, if you really want to grow as a hospital leader, you're going to have to get some additional training. And so I enrolled in the Citadel MBA program here through MUSC, moved over into investigational drug services as a coordinator in that department for another 4 years. It was during that 4-year span I got my MBA. And investigational drug services, IDS, that is something that is off the beaten track. Not everybody has a great opportunity to really discover what that has to offer. In fact, that's actually how you and I first met when I was in investigational drug services. But it really taught me so much because, the role involved a lot of moving parts, things like budgets, really getting to understand the pharmaceutical life cycle of a drug. And it was with that skill set that I was able to develop both through an MBA education and training, couple that with having to work with budgets, having to work with investigators, really starting to understand the supply chain of medication, that when an opportunity for the supply chain came up within MUSC, it seemed like a natural, evolution for me. And that's how I got here. Now, on a day-to-day basis, I manage things like the purchases of all the medication for the entire hospital system. Now, that doesn't mean I'm actually the one, clicking the buttons and walking the shelves. My job is more administrative. I oversee the contracts. I speak with and work with various vendors throughout the pharmaceutical supply chain, manufacturers, distributors, wholesalers, specialty pharmacies, things like that. I do a lot with things like the 340B program, controlled substances regulations, contracting, negotiations, and one of the most important things that I do on a day-to-day basis, networking.
Mm-hmm. And certainly, Jason, your job is very important and significant and challenging in this day and age with all the drug shortages. So I know that keeps you up, and MUSC Health is very lucky to have you to kind of do that. Also, a new thing on your plate is you serve as the South Carolina Society of Health System Pharmacists president. What is your role in advocating for the profession as the president?
Well, you know, Philip, over the years, I've found that one of the things I happen to be good at is I'm a good connector. It's just my nature. It's part of my job on a day-to-day basis, and also just I can be a chatty Cathy. But I've found that I can link people who have common goals, have common projects, or have information that can help somebody else kind of progress an initiative. So when it comes to advocating, those skill sets do come in handy. You know, so for example, in the early phases earlier this year, when COVID was still kind of new, but we were starting to really react as far as establishing testing sites. You know, I noted, along with several others, that pharmacists weren't being tapped by, you know, our state, namely DHEC, to administer tests or order tests. So I, along with several colleagues from SCSHP and our friend organization, SCPHA, we organized a phone call with DHEC, the Board of Pharmacy, representatives from the Medical Examiners Board, et cetera. And we wanted to make sure that we were going to discuss how pharmacists could be mobilized and or used in a pandemic scenario, specifically around, you know, testing for COVID. It was disappointing, but there was no great surprise to hear that those agencies really hadn't even considered using pharmacists, to be quite honest with you. So that was a good education for them to hear. And so my role, to kind of sum up, I just continue to jump up and down to everyone and anyone who will listen and say that, hey, you know, pharmacists aren't shackled behind a counter somewhere or locked in some inpatient pharmacy, you know, command center, but we are public servants. We're ready and willing to go out there and anything that patient care, anything that we can do to advance patient care that's still within our scope. I want everybody to reach out and say, hey, here's an opportunity for pharmacists to shine. And I want pharmacists to do that too.
Great. I know you ran for political office a while back. Can you share us a little about what got you interested in politics and what you learned from that experience?
Oh, how much time do we have? This is, I'll try to be succinct. So the short version, or my best attempt at a short version, is, you know, I don't have a very specific reason, but I kind of have a timeline. And so for anybody out there that didn't know, I did throw my name in the hat for state senate. The general election is going to be this November. The primary was earlier this June, and I did not win the primary. But you know, in South Carolina, our state senators serve 4-year appointments. And in November of 2016, when I got to my voting booth and I was casting my votes down the ballot, when I got to my district state senate, there was just one option. And without going too much into the partisan side of politics, I'll just summarize by saying there was just one option. And only one of the parties didn't even bother running anyone. And that really rubbed me the wrong way. So from all the way back to 2016, I had it on my mind and I began to research it like a good pharmacist. And it was over the next 2.5 years that I started to learn so much more. And, you know, when you start to learn more about something, you tend to get more frustrated. And that's what happened to me. And I really felt like our public servants weren't exactly serving us well. Moreover, you know, when you reviewed the backgrounds of our sitting elected officials, specifically within the state senate, there just wasn't much diversity there as far as their backgrounds. Now, I'm not talking about, you know, race or ethnicity or gender. I mean, let's face it, I'm a white male, so it's not like I'm going to be able to contribute to the diversity paradigm from that standpoint. But from a background perspective, it was really filled with individuals who, you know, I referred to as the 3 R's. They were either in office because they were rich, retired, or retained, or a combination thereof. And nobody really had a good, prolific background in public health. So there is a pharmacist, just for full disclosure, that it does serve in the South Carolina Senate, but that individual's background is completely different than my own. And I think anybody that's going to watch this with any type of, understanding of pharmacy can, realizes that we're not all cut from the same cloth. We don't, approach patient care the same way if we're in different settings. And, nothing against my independent pharmacy owning brethren out there, but, they see patients, but, I see patients from a safety net hospital perspective. And from one of the largest cities in the state, it's just very different with regards to patient care rather than a niche practice setting. So, and not to mention, pharmacists in a hospital setting, we have so much interprofessional collaboration with other healthcare providers, physicians, nurses, everyone in the therapies. And not to mention a large academic medical center. So when it came to improving public health, I felt I had a better lens to offer, the citizens of South Carolina and really try to raise the level of healthcare and education. You couple that with, I told you this was going to be, this is my short answer, by the way, Phil. Couple that with, my firm conviction that good health stems from things like good education and a healthy environment. In fact, when you talk to public health scholars, they'll tell you that those are inextricably linked. You will see better health when you have better education and you have a better environment with which to live and grow in. So to wrap it up, I just wanted to, ensure that my district had options. I wanted to increase the diversity with respect to just background, nothing against my lawyers or independent business owners and the clergy and things like that. But healthcare, I really feel like needs a lot more representation at a state level. And a lot of my activities, whether it's 340B or controlled substances, I end up having to coordinate with our government on a day-to-day, week-to-week, month-to-month basis. And I see some of the misunderstandings there. So I just wanted to improve all that. So I decided I'd throw my name in the hat. I did learn a lot. I would also advocate, if anybody does have a passion for it, it's not hard to throw your name in the hat with regards to any level of public office, whether you want to, city, state, local, just get involved, whether it's, just volunteering at, local food bank or, donating to a food bank or getting involved with your city council, town council, whatever. I really think pharmacists have a fantastic opportunity to serve the public interest outside of our day-to-day relationship with patient care.
All right, thanks. Well, so speaking of, kind of advocating, being involved, why should students and our alumni and any pharmacist out there stay involved in their professional societies like the South Carolina Society of Health Systems Pharmacists?
Oh, for sure, because things change every day. We are in a very dynamic, environment, not only with, healthcare, just in general. And I feel like we have some amazing pathways to communicate with each other. Now, not all those channels can be considered reliable, and I'm specifically talking about things like social media and things of that nature. But a professional society does allow you to connect. You can network with colleagues. It allows you and them to learn. And I've been around for a little while now, maybe not as long as some folks, but I can tell you from experience that the best resources as far as practical care come from connections I've made over the years. And so when I talk to, our students or my colleagues, I always kind of come at them like this. I said, you want to impress your boss? You want to, show off to your team? You want to look good for your patients? If you're able to tap into a professional network when the weird or the hard or the unusual or new situations arise, you can lean on something like a professional society that is filled with other yous that maybe have something that they can offer to help take care of your patients better. And next is being able to just share and educate in general. So, you look at our role as healthcare providers, we are told from day one when we first walk into a college of pharmacy that our job is to be continual learners. And so the participation in a professional society, just by its nature, allows for the sharing of information in a manner that supports good evidence-based, good data that we can really rely on that maybe other channels are a little weaker at.
Okay. So what one piece of advice would you give a current student or someone interested in the profession about advocating for the profession? How can we better advocate?
I always tell people, don't settle. You know, the profession changes every day. You know, when I was in school, the motto was work to the top of your license. And in fact, I still hear that a lot today. Mm-hmm. Well, I got to be honest, after several years of seeing what my colleagues are capable of beyond the top of their license, you know, I think that pharmacy's goal moving forward is to punch through the top of that license. I think it's up to us to establish what the new, you know, top of a license should be, whether that is being more involved on the front end with regards to, you know, medication decision making, collaborating with, you know, other healthcare professionals in the design and build of medication regimens to treat our patients. But I also say, don't always handcuff yourself to medication. Pharmacy is a unique trade in the healthcare setting because we are linked to both a tangible good and a service. Not everybody can say that. And so it does put us in a unique situation. And I do feel sometimes we are often linking ourselves perhaps to our own detriment just to the medication distribution pathways of medicine. I think we have so much more to offer, you know, cognitively in working with our patients. I think we're on a good track, but we need everybody swimming in the same direction, singing the same note, so that we can really provide that necessary the necessary good outcomes that our patients expect that we can give them.
Okay. Well, Jason, thank you so much for taking time to talk with us today.
Of course.
And thank you for your service to MUSC and our profession. I know the presidency that you're currently serving is just an add-on to your other work duties. And we certainly thank you for taking that leadership role because it is critical. And to all of you,
I appreciate it.
Yeah, thank you. And to all of you watching this on YouTube, thanks for joining us. I hope you'll join us next week at noon when we hear from Sarah Wyatt, who is a member of the class of 2022 and the College of Pharmacy representative for the MUSC Student Government Association. So we're excited to continue our Pharmacy Fridays.